So you received a hyaluronic acid and viscosupplementation injection to your joint. You may be asking, what do I do next? In this video, I'm going to cover my step-by-step aftercare instructions after getting one of these lubrication injections. For those who don't know me, my name is Dr. Sonam, and I work as an interventional sport medicine doctor up in Canada. Today, we're going to go over some of my aftercare instructions I provide patients with after I provide them with a viscosupplementation injection. Viscosupplementation, or hyaluronic acid injections, are a gel-like injection that I inject into joints primarily for the treatment of osteoarthritis, patellofemoral syndrome, degenerative meniscal tears, and a few more indications. The reason why myself and patients tend to like it is it is injecting a synthetic form of a natural occurring substance, hyaluronic acid, back into the joint. So it acts both as a lubrication and providing additional nutrition to the joint itself. One of the other reasons why people tend to like it is not associated with any of the negative side effects of cortisone, such as thinning out the cartilage. I'll be sure to cover this in more detail in a later video. Because hyaluronic acid injections are so safe to the cartilage, I can use them in my young, active, healthy patients. For example, the 20 and 30-year-old with a degenerative meniscus tear, or the 20 and 30-year-old with patellofemoral syndrome. It is relatively so safe to the cartilage that usually this is kind of my first-line treatment for a young, active individual. Now, the most important reason why you're here, what do you do after you get in the injection? Let me break down step by step some of my recommendations. Number 1, rest. So usually I recommend that people rest approximately 48 hours after the injection. Now, this is actually more important than something like cortisone, and the reason why is I've put a good amount of fluid into the knee, so it's not uncommon to feel stiff, sore, and achy. But I want you to not do too much for the first 1 to 2 days after the injection to allow the gel to lubricate the joint, sit there, and start to act. I have found that patients who do too much 1 to 2 days after the injection will call me up the next week and tell me their knee is quite swollen, painful, and upset. And usually when I ask them why, it's because they didn't do that initial 1 to 2 days of relative rest. Now, by rest, I mean active walking around the house is fine, 5 to 10 minutes walking up and down the street. I don't want you to be a couch potato, but I don't want you to do too much either. Number 2, soreness. It is not uncommon to feel sore for approximately 2 to 4 days post-injection. Hyaluronic acid is a very thick, viscous fluid, so it's normal to feel stiff and a little bit tight once you've had the injection done. I normally inject with a bit of freezing, so most of my patients walk out of the procedure room clinic feeling quite well. It's usually 2 to 4 hours afterwards where the freezing wears off, and then you start to experience the soreness. It shouldn't be too bad and should abate itself within a period of 2 to 4 days. Number 3. Ice and heat. So I recommend using ice kind of on and off the first 1 to 4 days after the injection to really help with kind of swelling and pain. I would avoid using heat for the first 1 week because it can actually irritate the symptoms and make pain and swelling slightly worse. Number 4, pools and baths. So this is really important, especially in the summer and spring months, but I recommend that anyone who's had an injection avoids any form of standing water, so lakes, pools, rivers, bathtubs for a period of 24 to 48 hours until the hole that I made in the skin closes up. This helps reduce any risk of infection. Now, specifically for saunas and hot tubs, I ask people to avoid anything with extreme heat for the first 1 week after the injection, only because it can make swelling and irritation to the area a little bit worse. Number 5, signs of infection. So this is one of the most important things I will counsel my patients on after I've given them an injection. Signs and symptoms of an infection usually present themselves as fever, increased swelling, increased pain, and a lot of redness around the joint injected. Now, usually infections take about 5 to 7 days to present themselves because the bacteria needs time to grow. So I provide patients with this timeline as well, so they can kind of get an idea of when they're expecting these symptoms to occur, if they do. Now, infections are extremely rare, but I always counsel people on the risks of them because if they happen, I want them to get in contact with their provider. Now, specifically with hyaluronic acid, you can actually get cases where the hyaluronic acid can cause an inflammation to the actual lining of the joint, which is called a synovitis. It presents itself with increased pain, redness, and soreness to the area, and usually this can happen a few days after the injection. Sometimes it can happen depending on the type of product that you use, if it's a very high molecular weight, so very thick molecules, or if we got the actual product into the area around the joint and not purely in the joint. So if you have any of these symptoms, please get in touch with your provider because we do want to rule out a risk of infection, but it can very well also be a post-injection synovitis that does settle down with the period of anti-inflammatories over the course of 1 to 2 weeks. Number 6, when will it start working? So one of the most important things I counsel patients on is the onset of action for a hyaluronic acid injection. Unlike cortisone, you are not going to see an immediate benefit in your pain. Usually, the injection starts working over a period of 4 to 6 weeks, and I'm careful to counsel people on this because if you're going on a vacation, for example, and the vacation is in 1 week, and hyaluronic acid injection may not be your best bet. In some cases, they'll actually combine them, and there are some products that combine a cortisone and a hyaluronic acid, mainly so that you can get that immediate pain relief, and then that hyaluronic acid can come on a little bit later. Now, the benefit of the hyaluronic acid is it can last a little bit longer, and I'll talk to you about that in our next point. Number 7, how long will it last? So with the hyaluronic acid injection, we're hoping for it to last for at least a period of 6 months. I have had it last up to 12 months in many of my patients, and usually we use them as yearly injections. Now, because hyaluronic acid is super safe to the cartilage, I'm not worried about a minimum or a maximum number of injections I can do. And usually it is safe to perform these every year to manage the joint issue that we are dealing with. For example, osteoarthritis. Number 8, physiotherapy post-injection. So the short answer is yes. The long answer is when. So it's important to start physiotherapy approximately 1 week after the injection. It gives it some time in the gel to settle into the joint, lubricate it, the soreness to come down, and then for you to be able to actually perform in physiotherapy. In a lot of joint issues, you can experience something called arthrogenic inhibition. Basically, it means that pain in joint means that muscles around the joint don't activate. So the goal with a lot of these injections is to bring down the pain in the joint so that you can actually strengthen the area around it, and then the muscles are no longer inactivated by that pain. Hyaluronic acid is becoming an increasingly used treatment option for the treatment of joint disorders in the sport medicine field. The reason why is it is healthy to the cartilage, we can use it in young people, and it tends to work for a longer period of time. Now, it is important to follow the post-care instructions by your provider because it changes on a case-by-case basis. I have mainly provided you with an outline of things to consider after your injection. If you like this video, please be sure to like and subscribe to my channel. I'm also going to link some other post-care videos up above. I'm going to leave some information in the description about hyaluronic acid and other treatment options that you can consider for joint and tendon disorders. For now, that's all.